Hi, I'm Dr. Sylvestre with Focus and Flourish. Welcome. As a veterinarian, it's very important to give out the appropriate instructions to pet owners so that they can properly care for the bandage on their pet. The first point I want to make is that client education is not at all the same thing as handing out instructions. The bandage is an active component of your treatment plan. You need to make the client a part of the treatment team for that patient, that the bandage remains in good shape for that entire week. And that will be your client's job. If that bandage is not in good shape, it, one, won't fulfill its function, or, and even worse, it can actually cause problems for the pet. What client education is about, it's about ensuring that the client understands the how and the why of what is expected of them. Here is what the client needs to know and understand when they take a pet home with a bandage. Number one, keep the bandage dry. That may seem obvious, but you really need to make sure that they understand the point. A wet bandage will hold its moisture for a long time because of all that cotton padding that we've put in there. Therefore, a wet bandage may never dry. But what happens if the bandage gets wet? The skin below the bandage will then be living in a wet or moist environment. And at first, that will just be irritating, not to mention uncomfortable in a wet bandage. But if the problem isn't solved, that irritated skin can quickly develop a bacterial and or a fungal infection. Now we have a full-blown dermatitis, not comfortable for the patient. If the problem is not solved, if the bandage is not removed, then that can be a really big problem for the patient. So now not only are you dealing with maybe a fracture that needs to be healed or a wound that you're trying to manage, but you also have to deal with the infected skin and how unpleasant and uncomfortable for the patient. Also, the gauze portion of the bandage, the cling portion that we apply to a bandage, when it gets wet and if it subsequently dries, it can contract, it can get a little bit tight. Probably not usually a big problem unless there's not a lot of padding in this bandage for whatever reason. Maybe that's what that particular bandage called for. But now we have a bandage that may actually be too tight and cutting off the blood flow to an area. How do you keep a bandage dry? Well, the easiest thing to do is just to toss a plastic bag over the bandage when the pet is taken outside. One of the things we commonly would send a pet home with is an IV bag that has been arranged with a gauze tie so that it can be used to keep the bandage dry. The plastic is thicker, so the pets don't tend to break through it quite as quickly. There are commercially available products such as the MediPaw. If a pet is going to be bandaged for more than a couple of weeks, this is a worthwhile investment for the pet owner. They can get these at most pet stores. You may even have them in your hospital to sell to them. Very worthwhile. Keep in mind that the plastic bag or covering, the protector, should come off of the paw when the pet is back in the house because we don't want sweating from the paws and condensation from being in this plastic environment. The other thing that pet owners may want to keep in mind is that the grass in the morning can be dewy, and even though it's a beautiful sunny morning, the grass might be wet. So the bandage should be protected so it doesn't get wet. Also, if the pet happens to be a male dog, some of them seem to have a knack for urinating right on that bandage. So it might be worthwhile putting a plastic protector over that bandage if it's a boy dog. The second thing is to check on those two toes that you left exposed at the bottom of the bandage. Those two toes are an excellent gauge as to how well fitted the bandage is. And a well-fitted bandage is a comfortable bandage. If the bandage is too tight, then we're going to see swelling at the toes. Now, how should the client monitor this? In the first 24 hours that a bandage has been applied, you should check those toes every 2 hours. If there's no problems in those first 24 hours, we know at least the bandage is of appropriate tension at this time. Then, as long as they check it, maybe twice a day, morning and evening. What we're looking for here, again, is swelling and an indication that maybe something has changed on the inside while this bandage has been on that we're otherwise not going to know. And what are they looking for when they're checking those two toes? They're looking for separation between the toes. So it's good to compare to the other paw, and they can see exactly how those toes are sitting. If those nails seem to be a little bit further apart, that's an indication that the toes are swelling. The second thing they can look for is wetness between those toes. Wetness is kind of the next step, because if the problem goes unchecked, then we're going to start to see some fluid that's extravasating from the vessels to just start and ooze out through the skin. Separation of the toes, wetness between the toes. That's what they're looking for. Thirdly, they need to do an overall check of the bandage and their pet, because this is where we're going to get more clues. So what should they be looking for here? Looking for slippage or movement in the bandage. Usually slippage is what we're going to see. Maybe the bandage was up to the dog's elbow and now it's halfway down the leg. But maybe the bandage isn't slipping so much as turning on itself. This kind of movement usually we see with the splint, not just the bandage. And so maybe the splint was put on the caudal surface of the limb, and then all of a sudden it's on the lateral surface of the limb. That's a bandage that's not doing its job, and it's quickly going to become a problem if we don't do something about that. If the pet starts to chew at the bandage. Now, I'm going to define this a little bit, because some pets are just going to chew at the bandage the minute you put it on. And we probably have all of those patients identified already, as do the pet owners. And some dogs and cats, if you leave any cotton protruding from the top or the bottom of the bandage, sometimes they just start to pick at the cotton. Why? Because they can, because they're bored, because it's there. I don't know. But they do sometimes like to just pull that cotton out. But if a pet has been fine with the bandage and now they start to chew at it, that is often an indication that there's discomfort at that level in the bandage, and it should be looked at. If there's an odor coming from the bandage, even if it looks fine, the toes aren't swollen, but there's a bad odor coming from the bandage, that's a problem. They need to bring the pet in for that. And also, if there's a behavioral change with the pet, and that can be something as simple as they're not as active, they're a little more lethargic, they didn't eat that morning, or they stopped using the leg, or they're more lame on that leg. Maybe they're already lame. That's why they have a splinted bandage on their limb, but now they're more lame. They don't want to use the leg as much. Those are often indications that the bandage is uncomfortable, that there's a wound, that there's a problem that needs to be managed. Don't wait. When should the client contact you? If any of the things that we have just discussed, they should give you a call. And at that point, depending on what the problem is, when the next recheck is, you can decide if they need to be seen immediately, or if this can wait for another day or until their pre-scheduled bandage change date. I hope this information is helpful to you to help educate your client. I suspect that this video will be watched by some pet owners as well. Please note, your veterinarian may have given more instructions to you than I am presenting here. There may be something about your pet's condition that requires some special attention and that I simply have not covered in this video. Please hit the like button and subscribe to our channel.